for allowing me to speak today. This happens to be one of my favorite topics, actually. Alrighty, thank you very much. Joining the Tarpon Total Health, chiropractor for the group. So my mission is quite simple: to see as many people as I can and have them live a long, happy, healthy, pain-free life. Pretty simple. At Tarpon Total Healthcare, your total health is my primary concern. Thank you very much. Not quite as good as promise, but I'm working on it. My late sister, my brother, myself, were raised on a farm up in Canada. Known her for 57 years. Been married for 35. There's myself. I'm like sniper, brother. There we are. The family there. This is the only one that's married so far. This one here. And we're waiting for our first grandchild, hopefully soon. My father passed away recently, and my brother's place up in Canada. So, what sets Tarpon Total Health apart from other clinics is that that enables us to successfully treat almost 100% of the people that come in the office, walking or limping. I have over 34 years of experience, treated over 30,000 patients in my clinic. Board certified, American Clinical Board of Nutrition. I made that point several times. I'll continue to do so. And I like cutting edge technology if it works. When I first came down to Florida, I couldn't buy a laser. I was trained to use lasers in Canada. I have lasers now. I like that. As you'll see in a few minutes, you have the digital motion X-ray. That's also kind of cool. So the decompression tables, fantastic technology. I like technology if it's effective. So one of the technologies we're talking about today is the DMX. All right, cool. It works. So this is a digital motion X-ray. The first thing you think is, well, that's a lot of exposure from X-ray. Actually, it isn't. 30 seconds on this device is the same as 1/10 of a dental bite wing X-ray. So that's super, super low exposure. They're built in Palm Harbor. John Postaway, who was an engineer, became a chiropractor. Big guy, 6'7", lots of big teeth, real nice guy. But here, you can see individual joints, how they move. Now I look at this, analyze it, I can freeze it, I can measure it. We have electronic measurements on this to see if there's any instability, because you'd like to know if the joints are unstable before your neck is adjusted. I think that's a good idea. So patients that have car accidents, patients that are athletes that fall or have injuries, or people falling from the roof at this time of year when they're trying to get their Christmas ornaments out, not uncommon. We do that DMX before we start treatment of the neck. So I didn't name this. This is the company that produces this, Guys in Medicine like that. So the DMX, unique technology, in 30 frames per second, you get 2,700 different images for a scan, let's say in the cervical spine, which enables us to isolate any one picture to take measurements and see if there's any instability. We can look at instability and make sure that what we're doing is safe. That's my preeminent concern. And again, 30 seconds is the same as 1/10 of a dental bite wing X-ray, which is pretty cool. So here's an example of someone who has 2 bolts in the neck. That person has severe upper cervical instability, and the neurosurgeon felt comfortable putting 2 screws, basically screw his head on straight and tight. Now, you'd like to know a couple of things. First of all, did the patient actually need it? And I'm sure they did, because this is not my patient. This is one of Dr. Postwaite's patients, at New Best, and you'd only do a study like that if you indeed saw that there was instability. So, X-rays, regular plain film X-rays, they have their place, but do you really know if things are stable or implants are secure? The answer is you don't until you look. So we do a lot of DMXs on patients that have plates in the neck, plates in the shoulder and the wrist to make sure that those plates and screws are secure. All right. How do you know if the joints that are being adjusted should be adjusted, or if they're unstable? We look and make sure that they are stable. From ankle injuries in runners to shoulder injuries in wrestlers, we make sure those things are stable. And we have that because we have the DMX. We're the only clinic in the 3 counties that has a DMX in a treating clinic. All right. So a safer, better, more scientific way of actually diagnosing injuries, and by doing so, I can provide faster, safer, and more consistent results to my patients. That's kind of what I do. So now, how can you help me? you have my intro sheet there, but on the next sheet are things that you can do to help out. So number one, if you've never been to a DC, what are you waiting for? Okay, gravity's not going anywhere, you're not getting any younger, you gotta make sure that your joints are good, your spine is in the best shape you can. If your strategy for health is winging it, not a good strategy. After 3 decades of doing this, that strategy doesn't work very well for very long. So in this meeting, I'm not gonna be your friend, I'm gonna make sure I'm someone you can trust to tell you exactly what's going on with your health and make some changes so you live a longer, happier, healthier life, which is my mission. Number two, if you're seeing a chiropractor and not me, that's a different conversation. If you're seeing one and your kids aren't, what are you waiting for? Bring them in too. I see infants from birth to about the first year 6 times. When they lift their heads up, sit up, crawl, stand, walk. Those are all major milestones in spinal development, and we want to make sure those spines are developing properly. After that, kids have colic issues, bedwetting, asthma, all things that we treat successfully to get rid of those problems in patients without any muss or fuss. And the DMX is especially helpful in diagnosing injuries when we talk about athletes and accident patients. Number 3, professional referral partners. Other chiropractors don't use DMX. I can't imagine not using a DMX to treat my patients. Personal injury and workers' comp attorneys, primary care physicians, and physical therapists, HR managers, and acupuncture and health clinics. HR managers and guys and gals who have big businesses, especially roofers, for example. Because those guys have a tendency to fall off and get injured, and if we treat without, as I said before in the other meeting, we treat without going to workers' comp, it saves you money, and we can do so legally. Coaches of all types want to make sure their athletes are running and moving safely. 1 minute, thank you. So, I always like that. You guys okay with this for me? All right, so that's me, in case you weren't sure.
Same suit, everything.
I want to thank you, and I look forward to your pending any questions and resolve any problems you have. Quickly, yes.
Do you do scoliosis?
Yes, yes, of course. Yes.
I might have a referral for you. We've been trying to get my brother-in-law's neck on straight for a few years. After the meeting.
He's got a drug record.
You already did. I'm a testimonial.
Any other questions? If not, I thank you for your time, and I look forward to seeing you all personally.